Okay.
Johanna, once again, I'm not seeing that assign host button.
Is it on the three dots in the top right of my
Doesn't give me
screen?
that. I wonder if I'm not the host. It doesn't give me that option.
Let me see. Does it allow you to set any co-hosts?
Nope.
And to start the meeting, did you sign into the county Zoom account?
I did.
That's so right. And I mean, it says the name as well. That's no problem. I think maybe we can just have, I can just walk you through setting the interpreters if it lets you do that. Do you see the option to set a interpretation on the bottom of the screen, the globe icon?
Uh-huh.
Great, then you can, I think we can go ahead and start assigning. It's going to be, when you click on that, there'll probably be two interpreters that pop up that are links. Don't worry about that. You just click the button that says add interpreter.
Okay.
And then from there, you can click on, it's going to be Rosabelle. So you'll see a name that starts LHLS, Rosabelle interpreter.
Got it.
And then you can click on add interpreter again. Oh, you'll probably have to click Spanish to English as the languages. It doesn't matter which order, it goes both ways.
And then she will add Jennifer, who's Spanish interpreter as well. There's two of us. Are you going to leave one of us in the main room to give the announcement in Spanish as to how to participate, or do they kind of know by this point?
I think we're all set at this point. I think
Okay.
everyone kind of knows, and then yeah, I think it'll be easiest if we just start it off right away. Do you see Spanish interpreter dash Jennifer as well as an option?
Uh-huh. I added her.
Great. Then from there, you can click the, I think it says start in the corner of that box to enable the interpretation.
So that start button is grayed out. It won't let me select it.
Let me just
Do both the interpreters have the language selected underneath them? That might be.
Oh, wait, it just came up.
Oh, perfect.
So what did
Great.
you
Yep. We got the notification that we can.
there?
Perfect. And
At
then
Apricot.
I wonder why it's not letting you make assign other co-hosts. Do you see on my screen, and this is where it might get a little bit confusing, not the screen that my picture is in, but the one that says my name. There should be just a Johanna Lawton somewhere on here.
I do.
If you can see, can you allow me to record?
I can make you host there.
Oh, okay.
Can I host?
Actually, no, don't make that one a host. Just allow to record would be great.
Oh, and I can do that from the buttons on below. So should I? It just says pause recording or stop recording.
That's fine. We're already recording, and this
Oh.
whole little beginning section will get chopped up anyway. But
No, it doesn't. Couldn't get it out at all.
Amy, just so you know, you're not on mute right now. If you click on my other screen, you can select. You should be able to select allowed to record. Does that pop up in those three little dots that pop up in the top right corner of my name?
allowed to record local files?
Mhm. That'll be great.
There you go.
And does it allow you to make Rosabelle or Jennifer the co-hosts as well? If you select their 3 dots?
I can do that. Should I do it for both?
Yep, that would be great. And then let me just double check. Do we have the ASL interpreters here? Hi, Ray. Great to see you.
Oh, likewise. Yeah.
Do you mind, Robin, last one, making Ray a co-host as well? That would be great.
Thank you.
Thanks, everybody, for your patience. Now I'm not finding Jennifer on the participant list. Oh, there she is. Got it. Okay, we should be set. Is that it?
I see Rosabelle has her hand up. I just want to double check if that's one that is still raised or from before, or I think, have you made Rosabelle and Jennifer co-hosts as well?
Yep.
Okay, then I think we should be good.
Okay, Katrina, I think we're ready.
Because of my lack of internet, Robin, I may have to have you take something that you asked me to do that I didn't have time to get to. But let's start this meeting. Rosabelle, is that hand, did you need something or? Maybe she's not. Okay. Thank you.
I'm going to jump in one last little logistical thing. Robin, can you just double check that my screen, the other one that says my name on it, it should just have my name and not my picture, that one can record. Oh, great. I'm the co-host now, so I think I might be able to also set that myself.
Okay, sorry about that.
Great. Welcome, everybody. Thank you so much for all the work that you've done over the last week or two. I'm kind of losing track of the time. I hope that everybody's getting as much as I'm getting out of this process. It's been amazing, and I've enjoyed it, even though it's been a little intense a few times. I love this process that we've established here. I'm putting the intentions for today in the chat, what we're intending to do. Sorry, maybe I am. And I just want to, and this is the part I'm not going to be able to do, maybe Robin, it says review subgroups work. We had 4 or 5 subgroups. One was Equitable Access, one was Mobile Crisis Response. We had Behavioral Hub Navigation Implementation and Workforce Shortages. And you said you wanted me to review the work, and I was not able to read those all.
No, I just meant that that's an agenda item that we're all going to be reviewing the work. Not
Okay, I was panicking. Then we also will want to talk about and keep in mind all of the things that that have been on our wish lists and in our conversations that may not get funded or bubble to the top, but that we would eventually want to keep in front of Boulder County or organizations as ideas that that could be worked on or implemented that we feel was important to carry through on. So those we also need to watch for as we're doing our work today. And then we're also going to talk about how people want to stay involved going forward. We've put a lot of work into this. We want to see that it's successful and implemented. So there will be an opportunity to stay involved once these meetings and the organizing all of this and the presentation to the commissioners is done, and even before the commissioners, to make sure that we're following up with the staff's work and making sure that it's all reflective of what we intended. So I will work on getting the agenda in the chat, but Commissioner Jones wanted to address the group before we got started on our work. So Commissioner Jones, if you wanted to say something.
Hello, everybody. Good to be here with you on my birthday. I won't tell you how old. I'm not young. So anyway, I just want to thank you for all the work you've been doing on this and your expertise that you bring to bear on this. This whole field, behavioral health, mental health, is such a challenge. It's because of lack of resources. My wife used to do work at CU with kids with schizophrenia, trying to diagnose earlier so they could treat earlier. And this was a number of years ago. And she'd come home talking about how you couldn't refer, there wasn't anybody to refer people to, and how frustrating that was. And it's not gotten better. And in fact, the pandemic's probably made it worse, as we know. So it's a long-term challenge, and I appreciate you doing it. I was reading through the groups, and they all said expand, and what's going to have to happen is they're going to expand and then contract. I don't like doing the wet blanket message, but it's true. Our budget's pretty tight already, and Marshall Fire made it tighter. So we're probably not going to have money to extend things. So you are the experts about how to best put together a program now that does short-term goals like stabilizing populations that have bigger challenges, that have fewer resources, that kind of thing. Also systems changes that might help us make it just better through time would be great. But you're helping us take this airplane off, and I'm just asking you to help figure out the best way to land it, because you're the experts, right? You're the ones that can help us figure that out so that we have some lasting impact past the 3.5 years that are left in the ARPA money. So that's my message. Again, thank you for helping us solve that challenge. I know even the ARPA money is not near enough to handle what we need to do, but it's a good opportunity, and I appreciate you helping us figure it out and how to have a more lasting change after the money is no longer available. So thank you.
Thank you so much, Matt, and happy birthday. Thanks for joining us.
Yeah, they don't mean as much as they used to.
I know, right? The older we get, the more we want to forget our birthdays.
Yeah, they are what they are.
Well, I appreciate that reminder about sustainability. I do think we have an opportunity in what's being proposed to really sort of do a reset rather than an expansion. And the reset is really about creating proofs of concept around more equitable access and using the existing assets of the community and engage with those assets in ways that we haven't before. I think we're trying to answer the question, are there enough? We know there's lots of money in the community for behavioral health, and is it coordinated well? Is it allocated in the right way? So we hope that with the ARPA dollars, we could demonstrate what might shift with our existing sustainable funds in the future, while also really opening the door for those who've been historically underserved. This morning we had an ARPA steering committee, and we continue to remind ourselves that we really want to use these funds to impact and prioritize those who've been disparately impacted. So Latinx, LGBTQ, immigrants, documented and undocumented, those who are differently abled. And, I want to also underline this historically underserved. That includes our rural communities as well as the mountain areas. So that will be our focus moving forward. After today's meeting, when the deep in the details work starts to happen from the county staff perspective, with, as Katrina mentioned, hopefully your continued engagement. But let's just put on those glasses for our meeting today around the sustainability issue, as well as the disparately impacted and historically underserved lens. That should be our lens for today's discussion. So with that, I'll pass it back to you, Katrina, and your subgroup working members. We'd like to do an overview of the work that the subgroups did. You may not have seen in your email, we sent this morning the reference documents that we're working on sort of as an end game. Those reference documents will inform how the presentation goes to the commissioners. So they're still very drafty, and I really appreciate the work that the subgroups did to fill out those forms. But the intention for the next agenda item is for the subgroup members to talk about the work that we did and what we came up with as we're doing more work on these proposals. So Katrina.
Thank you. And I apologize, we may have gotten the wrong document out for no, we got it right. I had one that was labeled draft, but I'm pretty sure this is where we're at. So my group on equitable access was, we had Tucker as our county staff gatherer and note taker, Craig from People with Disabilities, and Chris Current with the Netherland Food Pantry. And we had our original little group of ideas that Tucker had pulled together out of all of the stuff that he had read. And what it came down to, and I will love to have Craig and Chris jump in, is that there's a lot of behavioral health programs out there. There's some amazing examples, some things that are very successful, and something that we kept reaching back to was the Boulder Strong Resource Center that came out of the King Soopers incident. And it involved a lot of different ideas in addressing behavioral health, not just therapy sessions, but art and yoga and meditation. And it also involved reaching out to the community and making it accessible, in that it was moved from one place to an accessible place. And as we talked about that idea and how that addressed a handful of the ideas that all of our previous conversations had taken into account, we realized that there's a lot of programs, but what's not happening is the programs aren't being set up for success by not being funded, by lack of outreach, by lack of staff, lack of coordination. And so equitable access to us means not just funding the program, but funding the ability for the program to be a success, and making sure that underserved populations are getting access to these wonderful programs through different languages, different models of expanding and holding different sessions and ideas. Having these programs in underserved populations would also go a long way to reduce the stigma. So that's kind of where we ended up. Craig, Chris, Tucker, if there's anything you want to add to that, please do. And if there isn't, that's all for me. I don't know, Robin, if you wanted to take questions now, or do we do it in a discussion a little later? What made sense?
So I'd love to hear from the other group members who are on the subgroup. And I think we should take questions now.
Perfect.
I think, from my perspective, Katrina, what your group really highlighted was this issue that there are existing services that really need to be resourced as well as supported. And there are some, the front door service. So we talked about the accessibility. So what's the point of entry to maybe an existing service? And how do we really rev that up to assure that that's accessible? We've heard from working group members that it really helps when that service is provided in an area or agency or a school or a faith community that is already a trusted and safe space for people. We have examples of that. Sister Carmen has 2 MHP clinicians that are serving at Sister Carmen. Sister Carmen is a trusted community agency. So to have that access point there, that's another way of thinking about this work. So Tucker, you did such a great job on the documents, and really, I heard from Katrina what a good listener you were. You listened and translated their work into the documents. I don't know if you have any reflections. And then certainly Craig or Chris really invite you into this space as well.
I do want to comment that we have mental health partners up here. Sorry, Tucker. Up in the mountains, but they have no place to practice out of or work out of. So we have this availability, but no one can take advantage of it. So that was kind of where the pain point up here, and we realized that that's probably true for many other areas and populations.
Yeah, that's a great example as well.
And I'm done, Tucker.
Katrina. Oh, sorry, Katrina. This is Jen from NHP. Sorry, I'm on the phone today. I'm at a meeting, but just wanted to point out the mountain piece, which is amazing. And I think it's right. It's been a challenge for years. We've been trying to figure out how to best do that. And we are going to be now have a location with Clinica. And so we're going to be utilizing some space and sharing some space with them so that we will be actually in person located up in Netherlands, which is fantastic.
Okay, Tucker.
Yeah, I think a couple big themes that came from our connection together was that priority populations don't have an easy entry point in the mountains, like Katrina was saying, an actual physical location, or that there are a number of people that are homebound or aging in place and may struggle to go somewhere, and that there just isn't space for to have a building or like a more permanent structure. And so one of the ideas that did come up from that was having something that could be more permanent down in the Boulder area on the Front Range, and then something that could be mobile, utilizing, like Katrina said, a combination of traditional therapies and alternative approaches, and then could go to a mountain community and set up shop for a day and be able to offer education and treatment services all in one place. And then really tapping into the community-based organizations to help facilitate those types of things in reaching the populations that they serve individually.
One of the parts along with the missing location is that it needs to be managed and run. It needs somebody to make those arrangements and find those places and connect with the outreach people. And as the Peak to Peak Housing and Human Services Alliance coordinator, I know what a challenge it is to reach out into all of those communities and how much work it is. It's not always sometimes the challenge, as it takes time to establish connections and relationships with groups of people, and that needs to be funded. That needs to be part of the programs in order to, again, to make them successful. And then Craig also had in his, oh, are you going to talk, Craig?
Yeah, I can jump in. I was waiting for you to finish. Thank you, Katrina. Hi, everyone. I'm Craig with Center for People with Disabilities. And just to kind of continue with a little bit of where our focus was, it was really to understand what accessibility means and how many different dimensions there are to it, where it's not just physical accessibility, but it starts with the outreach and kind of the materials and the education about it, as well as the physical location. So there's lots of dimensions to what equitable access means. And then also is super important for the awareness campaigns to go along with it, because we have to really help our priority populations. We have to first make sure that they're receiving the information about these new resources that are becoming available in their community. And that's going to take really trusted sources of information. And it's going to be really important to utilize resources that we've used before, such as cultural brokers. And in order for that to be successful, there has to be funding for these communities to provide the cultural brokers and make sure that they're, being paid living wages to do the work to bring the message to their communities. So there's to be lots of levels to this. And, especially a brick and mortar facility or an online resource, it's only as good as, if you can reach the people that you're trying to help with it, where if the really priority populations aren't getting the message or don't have access or can't get there because of transportation needs or lack of connection issues or lack of training on how to use the technology to access that, that's all going to affect the end product and really have it be less effective in the long run. Yep, that's all I have now. Thank you.
Chris, did you have anything to add?
My only addition was that a lot of this is overlap and does require that we do the internet and broadband expansion that has been talked about. So some of the access is really feasible across the county. And in addition to that, when that access happens, there has to be training for folks to know how to access that, how to use their computers to be able to do telehealth. So there has to be an educational piece involved there also. And then we talked to sustainability would be developed around our data collection, and that we really needed to show that people were having increased access, and to be able to find the areas where we weren't successful enough yet to be able to increase access in those areas. And we thought with our data collection would be able to do that. That was it.
Thanks, you guys. I think you helped get it all in there. Thank you. Kathy has a question.
I do. I have a comment first, of course. And I'm so pleased that Commissioner Jones is here because I want to be sure. Can you all hear me? I am not on a.
Yes, we can hear you.
Here.
Yes.
I want to be sure to make this point that our entire, when we're talking about mental health, we're talking about the impacted population. And I want to keep centered in the conversation that we're talking about kids who are thinking about suicide. We're talking about elders who are showing up in the emergency room in larger numbers with substance use issues. And that when we're talking about the target populations or the focus populations for the ARPA funds, to me, this entire category is addressing a targeted population, which is, and by reaching out and serving most marginalized communities, we do something, I think if we do this intentionally, that's sometimes called targeted universalism, where a program that is effective and broadly serves the most impacted people has a benefit for the broader community. The classic case of that is curb cuts. Curb cuts were a hard-fought disability rights movement win, and who doesn't drag a suitcase around on wheels, thanks to folks who organized and worked hard to make that accessibility for people who needed to access using mobility devices. So I love what this group has said. I'm a little concerned about the brick and mortar idea. And just wanting to clarify, I did have a question, not just a comment. And I'll say also in my own family, I have sought and struggled with mental health access for queer youth, for Latina youth, and the issues of the most marginalized folks are also shared broadly, as we see when something happens like the Marshall Fire, where the broader community is also affected. And one doesn't know who the most affected individuals are going to seem to be. But with the, so Katrina, with the brick and mortar, what's in mind with that? I'm a little concerned because I think that could sink a lot of dollars into buildings, and some of the other ideas that you all have had about more mobile, multiple sites, something like the Boulder Strong. What are your thoughts?
Brick and mortar, when we look around places like Netherland, and that's something that there's been a lot of talk about stabilizing Western Boulder County, and there is no place in Netherland for people to do this. And I know Clinic is coming up and Mental Health Partners is coming up, but even that, will that allow room for yoga and meditation and larger group gatherings? And we don't have those types of places. And we don't have internet, so we can't do Zoom. So Netherland does need a place, and it's been talked about, it's become more evident. And again, Netherland's probably not the only place that may be struggling with the infrastructure or the place to gather for things like this. We have a community center which is going to be, which is being demolished. The pantry is losing their home. There is no existing buildings to go into. So we need to make sure that there is a place for these. The mobile part of it is there is a community center in Ward. We could definitely do a pop-up day there. But we know that consistency is important, and follow through and follow up and regular activities are important. And so brick and mortar is important to have a place to gather in a safe space. Some people can't meet at home. Anyway, I could go on and on because obviously this is something I care about for up here in Netherland, but that is part of the one of the reasons in all of my years working with Boulder County is watching all of these lovely programs happening and available, and absolutely no way to put it into the mountains maybe in Netherland, but never in other smaller communities like Ward or Jamestown or Riverside, Raymond, Allen's Park. Just that's the pain point, I guess. Did that answer your question? I'm sorry.
Yeah, well, let me ask a follow-up, because I live in Longmont and I don't really see that there's a need for a new building. But I'm hearing, in Longmont where I live in my life. But I'm wondering, so built into this project, might there be like an assessment? Could there be an assessment of are the right places and where aren't there right places?
Yes, I think the problem is there's no one size fits all.
Right, yeah.
Every community has its own unique abilities or disabilities in providing services, and those need to be addressed. And that's why the line, not funding the program, but funding the ability for the program to be a success, we probably need to add to that and say, in the populations and areas where it doesn't exist. Does that help?
Yeah, I think so.
So if I might interject, these are the exact questions that the staff group will need to dive into and do research on. So whether it's an inventory, whether it's using the social vulnerability index to review which areas are most in need, we won't have time to go into the weeds around solutions. Area. So no need to apologize. I appreciate anybody raising the question, and then we'll just put it on that list that will require further vetting and research. Desiree, I think you were next with a hand up, and then Craig, if I'm reading that right, and then maybe Jenna.
Yeah, so, I've been sitting back listening to these sessions. Haven't really spoke much, but in regards to, this isn't really a question, more of a statement and a thought, is regarding that moonshot idea. If we think pre-pandemically, we were probably all going to like Costco, Sam's Club, the grocery store, King Soopers to get our groceries. But COVID has changed that, because now we have Instacart. We still go to the grocery store too, and Costco, but we have been ordering a lot of things online. And I wonder if we should take a hint from grocery stores that something like the Boulder Strong Center could possibly work. But again, it would need to be that moonshot idea of being everything to everyone. So having a bricks and mortar, but not necessarily building something, but utilizing all the rental space that's available now, since so many businesses have closed. Also, having something online for people to access. And I love the idea of pop-ups, because that's something that was really starting to pop up before COVID, but then because of COVID, it stopped happening. So really utilizing all these different ideas and really taking a look at how like retail stores have done that and apply that to mental health and social resiliency. And also the one thing I want to kind of go into, or not, maybe not go into, but highlight, Kathy was kind of talking about it, how we're focusing on young adults and suicide and older adults and mental health conditions. But let's talk about the pre-stuff with older adults. A lot of it is that social isolation that happens sometime, maybe if someone retires to the point of like older age, but like, how do we get to that preventative side too? Because it's not all about clinicians. It's about these programs like Circle Talk or the Senior Center. That's a national program for people to tap into. I think we could get a little bit more creative there, and that it's not all just mental health or behavioral health, although that's a huge chunk of it too. So those are my thoughts.
We did keep going back and figuring out like what also constituted social resiliency. So a lot of this, we realize we never say social resiliency, but when we're talking about the older population and other populations, it's more social resiliency than mental health. And social resiliency can help alleviate some of the mental health issues that come up.
Yeah, I just wanted to add, I think we just wanted to really point out the value that in-person brings to people's lives and the community. And when we say brick and mortar, it doesn't necessarily mean building something from the ground up, though if there's a community that doesn't have that, that's definitely something that would be looked at, but it's more looking at existing locations where we can use multi-use spaces to incorporate these new centers. And we pointed out kind of schools, churches, or libraries, but also it brings long-term value and shows commitment to the community by having physical in-person locations. And I think that's really important, but it's also as important to have the hybrid model for people that can't get to them or have access. So that's why the underlying infrastructure of broadband is super important to enable these hybrid models in addition, but I think it needs to happen simultaneously, and it can't be one or the other.
Thanks, Craig. Jenna?
So, well, I'm just going to make a comment on what Craig said. I was going to bring up existing locations and partnering with existing locations in the area. And, you know, another thought I had, well, I mean, broadband, we definitely need to get in there, but a couple questions, Katrina. Do you know what programs are in these areas already? Have we done that research? Because I know when you and I spoke, you were surprised that we were in schools there. Like, have we identified what programs are even being offered up there that, for example, I haven't done a good enough job letting people know, right? Are you going to be doing research on that? And are you going to research what the community wants? Are you going to be surveying your community to learn, would they use a brick and mortar? Or if they had broadband, would they prefer to do yoga online? Would they prefer to do those activities online? Or would they be willing to show up? Is this all research that's going to be done around this to learn more?
So I think county staff will look at some of that, what's available. I don't know what's available. And from my perspective, there's very little available, you know, in Netherlands. So, and I'm a pretty well-connected person. And if I don't know those things, then other people don't know what's there. So funding the ability for the program to be a success is, yes, doing the assessment about what would make the program successful. Not throwing a bunch of things at a community and then hoping somebody runs with it. Making sure that that it is something that there's someone in the community that's going to work with it and make it a success. So there's lots of opportunities and there's lots of programs, but what fits the community the best, what's worth putting time and effort into in the different communities based on their personalities and accessibilities. So yes, that would be a part of all of the moving forward and getting to those recommendations later.
I think that's also part of the outreach that we talked about that really needs to happen so that people know that those programs exist. And there have been programs that worked. Senior Reach worked well for our seniors, but it went to all online through COVID, which made it was inaccessible to the majority of our seniors. So it's all tied into broadband and outreach, and there are pieces that need to happen all together.
And then Katrina, one other follow-up question, I'm sorry to that, was I think my only other concern is I'd love to learn more about mobile opportunities and being able to meet people where they're at. Because a lot of, I think, the populations that you're referencing may not even be able to get to a brick and mortar. So what could we do to meet those people if it has to be at their home or has to be at a park, someplace that would be accessible to them? So I'd be just interested in learning more from your group on what that would look like too.
We were just kind of using a pop-up model. We identified a few places that we could possibly have that we could rent a day a week. You know, the problem is in in making it equitable, it has to be accessible. So I can think of many places that are available, but might not be accessible. So it's the work in setting it up and establishing those systems and those places, and then making it a part of the community. So you're setting some expectations, and I would love to see it happen in the communities. I know there are some mountain communities up here that would not be open to something that said mental health, but so it's designing something that is more accessible in meaning, but using the same program. So it's dedicating some of the resources of the ARPA resources into establishing these programs and making them accessible and setting the expectations. And once that's done, they should be fairly sustainable by the communities. It's just getting in there and getting that initial part taken care of, and handing it off to the people in the community that are going to continue it and make it work.
So I wanted to use this as an opportunity to segue to our next group, because Jenna, your question about do we know what's available links to the Behavioral Health Navigation Hub work. And so Julie, I see your hand is up. Do we want to take yours as a last input? And Desiree, your hand is still up. I didn't know if you had an additional comment. Julie?
I just had a question while we're talking about this. Because we were talking a lot about the co-responder model, and we learned that Mental Health Partners also has a mobile unit. Is that available in Nederland?
Our co-responders goes through the police department, and they chose to work with the Boulder County co-responder program. I couldn't speak to why they switched from Mental Health Partners to the Boulder County model, and it could just be the availability of the people to be up here or connected with the sheriff's department. So I don't think there was anything in particular, but we do have a co-responder unit that works up here.
Sorry, I didn't phrase my question. Yes, I see that in the report, but so you don't have Mental Health Partners mobile unit working in Nederland currently. Okay.
Let's let Jen Leos weigh in, if you're still on the phone.
Yeah, so we do have a mobile response team as part of our crisis team, and they can serve anywhere in Boulder and Broomfield counties. That's part of what we do. And again, as people have talked about, some of that is part of resourcing, right? And so if we have the staff, typically it requires 2 people to do a mobile response. And so some of that is capacity based.
Thank you.
All right, so let's move into the Behavioral Health Hub navigation. And I wanted to invite Marcy Campbell, who was in on this group, as well as Ellie from Together. I think we had a good conversation about the existing program and the aspiration and plan that we already had pre-ARPA for that program. So Marcy, do you want to provide an overview of the conversation?
Yes, I'm happy to do that. We had a really good conversation, and we're able to think about what work is currently happening with the hub. So I can just share the high level of that, and then also talked about what we would like to see in a hub, and thinking about the different ways that folks might be able to access it. You know, what is that ultimate vision of what a hub could be for our community that really serves all folks. And so there was previous research done about the possibility of creating a coordinated referral system where really anyone could, from the community, could potentially call or text to get referred to appropriate services, both in behavioral health as well as social determinants of health, knowing that housing and other needs really are impacting folks as well when we think whole person. And currently there is a phase 1 of the hub development in process that's really focused on those currently interacting with law enforcement or criminal justice services. And the co-responder team through Boulder County has been able to start piloting that approach. And so there's a hub implementation group that's really working towards that. But when the research was conducted initially, there was some hope for this broader vision of the full community being able to access that. And so when we talked in our team a little bit about, well, what could that vision look like, taking what was maybe already learned and new ideas, some of the things that really stood out were the fact that people may want to access that navigation in different ways and maybe for different periods of time, that it's really helpful for folks when we think about maybe youth and young adults. Ellie from Together was sharing with us about the fact that there may not be other positive adults kind of supporting young people through the process, especially as they're no longer becoming youth. And so having the need for a little bit of care coordination for a longer period of time might be useful for folks. But we really wanted to think about that this could be accessible for our different priority populations that we've talked about, individuals with disabilities, et cetera. And that there could also be a component by which we're really breaking down those silos and the different providers have the ability to connect with each other. We talked about navigation, and the county is hiring a navigator already through an existing grant to serve that population currently interacting with law enforcement or criminal justice in some way. But the hope to have maybe more of those folks that could navigate with other navigators, knowing there's lots of great community connectors like at El Centro Amistad or Al Boulder County or Together that are already working with populations, and maybe those navigators could be connecting together, having some shared trainings, and having the opportunity to make sure that folks are getting their needs met, and where needs are not being met for some reason, that we could really lift that up and see what our gaps look like. So I'll just pause there and see, Robin and Ellie, what you have to add or fill in.
Ellie, anything you want to add?
I think you did a great job, Marcy, of kind of setting the stage there. And yeah, I think there's so many intersections with, I think, the previous group's conversations and what I'm guessing will be the next group's conversations as well. There's so many intersections and overlaps with, I think, some of the big goals and ideas of what we want to do. And I think with this hub, there's so many opportunities to have it kind of be that one-stop option for everyone. So having kind of layers where it's, of course, for people to get access to mental health resources and beyond, but then also a place for providers to connect, and then a place for the public to come together too. So I think about, the connections with one of the other ideas that came up in our initial, I think, kind of brainstorm of ideas is leveraging more of those, community circles and community groups and events that are already happening that really promote healing and relationship and kind of help solve some of, I think, the mental health issues that we see. I mean, I think these moments of healing happen in really small, amazing ways every day when people are able to connect. And so that hub be an opportunity to bring some of that together more as well. And I think some of the big pieces of, the equity that came up in our conversation too, is how do we make this platform or this hub or whatever that is going to be, how do we make it really accessible and open to all of our priority populations that we've talked about? And so how is it easy for people to turn to that and get the support they need? And how is it, do we have the right language? Do we have the right all the right kind of entry points to it. And I think so much of this too involves all the providers really coming together and looking at what we're already doing, and then how can we kind of leverage some of those pieces and some of that learning to implement into this hub. So it's an exciting / big project.
I don't have anything to add other than to, again, emphasize the connection between these, as has been named, in terms of the hub is the foundational entry point that then brings that awareness of what is existing and what's working, and how to access. And I would hope there'd be a continuous feedback loop in terms of as people engage in services, and then how does that inform the hub communication. So I invite any questions or comments that the larger group has for this particular topic area.
I want to add one more thing too. I think that this touches on kind of the paper and documentation piece too that has come up, that I think ideally the vision for this is to have that be a little bit more streamlined and easy for folks to get the access and meeting them where they're at, and making that process more streamlined. So that's important to lift up too.
Katrina, I see your hand up.
I just wanted to comment the hard to serve places, the homeless, and that makes it really, really tricky to reach out to. And one of the things that we've had when we've looked at homeless populations up here is how much information is needed to apply for some of these services. So that's always kind of been an issue. But also I would love to see, and hopefully this comes out of it, is streamlining and putting all this in one place. How much money does it save somewhere else? We get accused of throwing money at all these things, but it would be nice to know that what we're doing is saving money in other areas and showing that this is more efficient. So that's just my comment.
Yeah, many communities do sort of a reinvestment strategy, and it's something that's happening with our Impact Collaborative. As you save money in one area, how do you redistribute those dollars for more front-end prevention or intervention efforts? It's hard to do, especially when the pot of money exists for one entity. They're not likely to want to reinvest it into a broader need. But it's just something to highlight. Any other comments or questions? And I want to acknowledge Kathy's chat.
Yeah. Yeah, I won't repeat my chat other than noting how impressed I am if, following this closely, a meeting with county staff working on the behavioral hub approach, that this to me really feels where an influx of significant ARPA funds can get a great idea. To me, there's a moonshot aspect. And the beauty of this is we've already got the engineers, if you will, building the rocket ship. And when the hub concept is fully realized, I've been talking with the parents, families, various communities about mental health needs in Boulder County as a grassroots person for years now. And I think that this is the glue, and I'm excited to see it being talked about at this point. It just seems unbelievable to me when you say a navigator for Boulder County is going to be hired. It brings tears. It really brings tears to my eyes.
Thank you, Kathy. Jenna?
So I agree with Kathy, by the way, this is really exciting. This is a huge gap I've heard since I started with our organization, and people they don't know where to go to find help. My only question, and I guess recommendation for this would be, I think once it's put together, are we going to have funding to create a very large campaign to let our community know about this? And making sure, like, I know when we look at outreach, our outreach is to the uninsured and underinsured population, right? So it really takes that, it's a different mindset when you're marketing to marginalized communities. So I guess my wish would be that we put money away to be able to let these communities know and be really smart in how we connect with them. But I think it's going to be so important that we let everyone know that this is a resource, because it's so important and so needed.
It's really great to underline that, Jenna. Thank you.
And I want to point out too that it seems to be, the outreach seems to be always kind of an afterthought, and that somebody will go post it on social media. In the mountains, we have to budget for a newspaper campaign because that's where people get their information.
Okay. So, Jen Leas, are you in a space where you could talk a little bit about the workforce document that you created, and especially just highlight anything different that came through your perspective about the workforce shortage? You already talked with the group about this and what you know, but I don't want to put you on the spot, and I recognize that you're kind of multitasking.
No, it's okay. Yeah, I don't have the document open, but I can just speak to, I think the document just highlights some of the, obviously, which this whole group has been talking about and knows firsthand about, just some of the rising need of behavioral health services, right? And then I think, I just think some of the high points of it are that, which we've talked about, but just to highlight, is that I think with the increased need, I think the higher acuity levels that we're seeing of behavioral health needs, and I think just the funding and just in some of the competition that's come in, it's really made a challenge to fill behavioral health workforce. And I think we talked about there's different flexibility, there's, and people have left the field. And I think because of some of the burnout and some of the challenges. And so I think really just knowing, and I know someone had stated it early on in that first work group around, how do we support the current services we have, knowing that we still have gaps and there's things we need to develop, but just really there's a concern around, how do we stabilize current service delivery with some of this workforce crisis going on. And I think some of it really is around what are the retention strategies, how do we keep people, in their positions, and how do we recruit. And so I think there's different retention and recruitment strategies that we can do across the county to help support all behavioral health providers, right? Like just that workforce in general. And so, but I really feel like it's a high priority for us in order to take care of any of these initiatives that we need in order to better support the behavioral health needs of our community.
Yeah, this is a real challenging one. And Jen, I really appreciate, Jen was a subgroup of one on this topic, and I really appreciate the background document that she filled in that will inform the continued work that the county staff will put into this issue.
I have a question or a thought around that, because I think we're seeing that in the human services world in general, that people are leaving the field in kind of mass amounts, and just curious if there's a place for kind of prevention of that in some form. I think I'm currently revisiting the book Trauma Stewardship, and I don't know if any of you have have read that, but it's about how to care for yourself when you're caring for others. And that can be in any, it's not just human services, but also, with the climate crisis and all of just the things that we have happening in our world. And I know that MHP does an incredible job of training staff and has a lot of resources that way, but I wonder if there's something greater as a community that we have an opportunity here to kind of support behavioral health and human services staff in that way that we haven't thought about. So it's kind of more of a question, are there other creative opportunities to just support that compassion fatigue in new and different ways. And I think some people are of course going to leave, and that's just, we will be in support of that always for people to take care of themselves. But just a thought.
I completely agree. I think we are so much better together. And I think I just think, if we somehow combine some of the resourcing that we have to put something together, and if we have some of this funding to do that, I just think there's great opportunity there. I think regarding that training, just competency, like you said, compassion fatigue. So I just, and I know Rob and I am going to have to drop off. So I would love to be a part still ongoing with some of this, because I do think it would be helpful to put energy in how we can pull resources together. And I think there's a way, it's like, I would love if we can just keep people in our community. We have so many amazing experts and compassionate people. And, if someone leaves MHP and goes to human services into a growth opportunity job, but they maintain in that field with that expertise, like, how can we encourage that, right? Like, how can we encourage things across sort of the behavioral health, entire field, and support that, so that we just don't lose people out of our community. We have so many great providers.
Yeah, that's a really good thought. And I want to acknowledge Johanna's chat that this is being discussed as a priority area for the Economic Challenges Group. So that's good that they've been talking about this a lot. And we look forward to hearing what recommendations come forth in that arena. Desiree, I see your hand up.
Yeah, so this actually brought up I guess more of a comment. The incentives to keep people in positions sometimes isn't like monetary. So I don't know if throwing money at it would help, but one of the things, and I'm gonna talk about the community services department, but what was great when I was working with community services is that they offered clinical sessions for staff. And these weren't group therapy for staff that are having problems, but problems in their personal lives, but more so problems with the work itself and how to work with community members. And that for me really helped because, I had a group of people, other professionals, besides people in the county, that we were able to pass around ideas to kind of alleviate the stress of the job itself. I know not all jobs can have that, and it was a luxury at that time, and I'm hoping that they still do it. But, even thinking outside the box in terms of the addressing workforce shortages, burnout, focus area of economic challenges and everything, but it's more so than just throwing money at the problem sometimes too.
Thanks for that, Desiree. And yes, we still have that resource. And it reminds me of the trauma workshops that MHP put on during the pandemic that were really helpful, and secondary trauma workshops. So I do think, Jen, I loved your idea about this cross-sector, collaboration. Given, again, and to my opening comments, I think there are some really rich assets in the community that either we all don't know about or that are underutilized. And that includes the cultural capital that we have in this community. So we don't want to lose sight of that. Katrina.
Yeah, the cultural capital, in looking what's available again in Netherland, there is, church space, and I think there would be community members who would be happy to do some training and be some volunteer peer counseling and work with their neighbors. Or a lot of the mental health training, I took the mental health first aid and it was amazing, the first one. But it just gave me a different perspective in when I come across people that might be challenged. And I think that the community wants to be able to do more of that. I hear that, what can we do to help without going to school and getting a degree? What can we do as we're walking through the grocery store, and see somebody and chat with someone. So I think for workforce, I know it doesn't replace it, but just teaching your community about it, reducing the stigma, that kind of stuff.
Great. Before we move on to another subgroup, are there any other reflections or comments or questions or things you want to note for the staff work parking lot? Okay, I'm not seeing anything. So the other subgroup was around looking at the co-responder model and delinking it from law enforcement. And we had a good conversation around that, what that might look like. I can just give a summary of what that might look like based on the document. I didn't do a great job filling out this document, but and then I'd like to invite the subgroup members to round out the conversation. But really, the proposed project would be to resource a mobile response team to engage individuals experiencing a mental health crisis in order to de-escalate, assess, decriminalize, and determine a care plan that would result in increased access into behavioral health treatments, therapies, supportive services. The program should be culturally responsive and coordinated across jurisdictions and across county services. So I'll stop there and invite Kathy or Jenna or Julie to engage and participate, to provide an overview to the broader group about what we discussed and what we thought would be important to bring to the table. And Jim Adamsberger was the staff support to this group too. So Jim, I invite your insights.
Well, I can go. I've been in conversations on this with the subcommittee of the NAACP, Boulder County NAACP, and additionally with my organization. We just think that it is really important that this service, both co-responders, which are linked with law enforcement, and mental health response, are available countywide with broad hours, ideally 24/7, and looking into what that would look like, what the hours of need are, so that a culturally responsive, non-traumatic mobile service can show up where needed and provide stabilization and support as close to the person or family in crisis as possible. So we think that the county has a real opportunity to link the programs, both their own co-responder programs in Longmont, Boulder, CU as well, Louisville as well, MHP's mobile unit, but also to expand and ensure that such services are readily available. And I'll pass it to Julie, or Julie, do you want to follow up?
No, thank you, Kathy. That was fantastic. I think you encompassed everything we discussed, and just, yes, I want to highlight and emphasize that while we want it to be there to be more comfortable access for people who wouldn't call 911, we don't want to completely, well, at least I suggested we don't completely lose that access point as well, since when 911 is called, I think there's been so much success for having that co-responder go along with the police. There's been 0 arrests as far as I understand. And I'm sure that our law enforcement are learning de-escalation tactics that maybe they aren't as trained in as the other professionals going along. So that's the design element that I'm hoping we can expand, and also hiring bilingual and culturally competent responders.
I think it's important to recognize that we also looked at this through the lens around equitable access, as well as the entry point. So if an entry point is a crisis that is causing alarm or worry about safety or other issues, we want to make sure that this could be an entry point into services as opposed to into the jail or into a psychiatric hospitalization. So just recognizing the outcomes for why we want to look at this a little bit differently. Jen, I wanted to invite you, and then Katrina, I see that your hand is up.
Yeah, I think Kathy and Julie said it, and Robin, you said what I was going to say. I think it's important as we look at the co-responder program that we know the services, when those co-responders go out, they know the services that they can send these people to. So I think it's important that we work with those groups, the community groups, to let them know what's available for the suicidal youth, for the elderly person who may be struggling with their mental health or suicide. So it's not a, we're going to come see you, de-escalate, and then just leave you. It's we'll come see you, de-escalate, give you the resources that you need, or connect you with the resources we need.
Katrina?
This is one area where Netherlands is very experienced, and I wanted to make a comment on the co-responder. I've had some conversation with people who have been, who have gone through the co-responder process, and I was amazed at the follow-up that the co-responders did with these people in connecting them with services. We have a peak-to-peak services guide that we provide our fire department and our police, and we make sure that the fire department and the police are very well aware of what little there is up here. But I was very, very happy with the follow-up that this co-responder team was doing up here. It was just amazing. And they were also very complimentary of our police department, who has had to learn to be fairly self-sufficient given our distance from anything. So I am a huge proponent of co-responder for those reasons.
Can I respond to that as a team member? Absolutely, the co-responder model is essential, that there's often a reason why a police or a sheriff is included in a mental health call or a wellness call or responding to a person on the street. However, there's many times and places, and a gap that we would be filling that will be beneficial to our targeted or priority communities, is that there's many people in the county who, for whom the police, they will not call the police because of documentation status of people in their household, because of issues. We're doing a survey now with our within the NACP to hear stories of that, and especially for our youth, our suicidal and queer youth with mental health problems. The trauma of having a police show up, it adds to. So in looking at we were talking on the team about the right response for the right situation, and to have this coordinated through a county coordination opportunity would build on what for instance, in my town of Longmont, like you're saying, Katrina, up in with the police up there's real buy-in and really excellent work being going on with the co-responder program. But there's a need to have these to fill in the blanks, and also that people know what to expect countywide. So some role of the county in ensuring that the different police departments are responding, you know, somewhat similarly, so that when you call the co-responder, you're from Longmont, I call a co-responder in Boulder, and, you know, a person shows up in a simple SUV wearing, you know, wearing street clothes rather than, you know, multiple patrol cars. So it's a real opportunity here to leap this forward.
I've always wondered too about the money part of this, you know, where is the money, the savings that we may be realizing by not going to jail, you know, those kinds of things. So I'd be curious about that part of it through this process.
Well, we know it's reduced jail beds, so there's an automatic savings there. The trick is how to reinvest those dollars. Jim, I didn't know if there's any observations you wanted to share, or
I'd just say that compared to some of the other projects that are being discussed, this one is a little bit more concrete. And so I think we have the ability to really explore what this could look like and put some real content to it to bring forward budgetarily as well as operationally. So it feels like, given that we're already kind of working in this space, this would not be a real difficult one for us to figure out.
all right. I did want to acknowledge that our behavioral health team has started to do some initial work on exploring the urgent care center, because I know that was really important to the group. That's a bit more challenging, and we didn't have anyone sign up for a subgroup on that, but we haven't completely left it off. So I just wanted to name that. And I think if it's all right with the group, it would be good, it's 20 afternoon, watching our time to move to our next agenda items. But before I do, I just want to make sure, again, you know, our staff commitment to you is that your voice comes through loud and clear in what we're going to be working on. And so we really want to hear from you about your continued engagement, and how do we make sure that we have check-in points with you beyond this working group as the staff are vetting the projects, and how you would like to stay engaged in that work. And then the other question is for the actual presentation. I know that Rebuild will be working on a presentation template for all of the working groups that we will provide content for, but really want to hear from you in terms of about your engagement now that, since this is our last formal working group. Everybody's like, oh, we're so glad the working groups are done. Don't make us do any more work.
I know what we found with the subgroups is once we posted something that was a little more concrete, some people volunteered because they saw what it would involve. So just because you raise your hand and say you want to stay involved doesn't mean that you, correct me if I'm wrong, Robin, but that, you know, that you want to stay involved, at least know about things, and if there is an opportunity to do something, how to jump in.
Yeah, I think there'll be natural feedback loops as the projects are formed, that we could email to the group and say, you know, this is the more detail we've gotten to. This is how this could actually be operationalized. What do you think? That kind of back and forth. We have to be thoughtful in our use of time, because we only have 2 to 3 weeks to get this right, to be able to raise it up to the commissioners for a recommendation.
But Robin's right. We don't want to lose your voices. So please, at least keep following up yourself.
Is there anything from what you heard today that you want to make sure that we really remember, and in that we really need to prioritize, and that we need to keep front of mind? I think you've all expressed that very well today, but in case someone did not get an opportunity to speak or thinks that we missed something based on what we talked about today, would like to invite you to share your thoughts or say, no matter what, don't forget this, so that we can really make sure that we're getting it right. Oh, Kathy, sorry, I missed your hand.
I was really hoping that 2 or 3 people that were quieter than me were preparing your thoughts, and we'll speak up too if you're feeling comfortable. I've said a lot, but I think, is Commissioner Jones still on the call?
No, he had to leave.
He had to go, so I'll say this. I wanted to say this when he was here, but this idea of a moonshot, and to me, what we're doing here sounds so much like a moonshot idea, that I just want to be sure that we can convey this to people. We're a table of people who all have a lot of direct experience in some way with a set of people for whom this will make a huge difference. But you know, responding to mental health for decades has kind of been like a second tier concern, not just in our county, but in our society. And the moonshot is putting this right up front. And so, you know, I'm hoping we can convey that to the decision makers.
Yeah, I really like it. Just the fact that we're naming it and prioritizing it and talking about it in depth the way we have, that alone is a difference, right? That alone is a significant difference. And I don't want to minimize all the amazing work you all have already been doing for years and years and years. But yeah, let's keep that front of mind. Thank you for that, Kathy. So I wanted to check in with Amy or Johanna or Dr. Liz, any of your observations based on what you've heard. And when you think about the broader context of the other working groups that we should use some time this morning on.
I just want to say that what seems to be the key point in a lot of the discussions, especially when we're thinking about the moonshot idea, is accessibility and outreach. That definitely is the flavor and the trend, because that initially it seems that has been the issue, even if the programs are really out of the park. If no one is aware about it or can't apply for whatever reason, what good are they, right? So that has been a trend.
And I'll just add that if there are specific ideas around how to do that outreach or how to implement the program so that it is different than what government has done as normal, like for instance, one of the groups is thinking about creating a government and non-government advisory board through implementation. Or maybe it's about creating an expertise panel of marketing folks, who can come in and really help. Whatever it might be, it's your ideas, but just thinking about like, not the fact just that you have to do better, but thinking about how you can do it better and what are the ideas to ensure that that happens through implementation.
Thanks for that, Amy.
I think that captured everything I was thinking as well.
And Leslie, Irwin, I don't want to put you on the spot, but I didn't know if there was anything that you heard that you wanted to say, from the ARPA eligibility lens for us to be mindful of.
I'm sitting outside. Hi, everyone. I don't. Your category has really broad eligibility, so I don't have any concerns. I do think the outreach is important, and that's eligible as well. Treasury calls out specific areas where outreach is eligible, and behavioral health is one. So that can be funded with ARPA. But your ideas are very powerful, and it's exciting to hear them.
I know another deliverable for the county staff is to create a list of ideas that didn't make it into the top priority areas. I think we have captured that list. That was our first working group. So I invite the working group members to review that outside of this group and definitely email me and Katrina if there's something that you want to make sure, because I think the commissioners really want to, think beyond ARPA in terms of the county's role in supporting what the community needs and what came up during this process. So I think we're clear on our top three, recognizing that workforce shortages are sort of the foundation of all this work. But I just wanted to name that to make sure that you knew we didn't forget that there's that bigger list that the commissioners will definitely let the commissioners know about.
Robin, would it be helpful if I drop the spreadsheet in the chat so that if the working group members want to start populating that list as you go about these discussions, it might be easy to start keeping track or moving what you have in those previous documents over?
Sure, that would be great, Johanna. Thank you. So I want to make sure you get your time back, but since we do have some time, I wonder if it would be helpful. I would love to hear from all of the working group members about what this experience gave you, what takeaways or ahas you gained from being engaged in this group. I sincerely hope that this informed you as well as brought something to your practice and agency and community, that it wasn't just a sort of taking from you and taking your brilliance. But I really would invite any of you who would like to talk about that in terms of your experience working with the group and any ahas or takeaways.
Were we going to narrow the ideas down? I might have got lost here because I was.
I think we're clear on our top three.
Okay.
Yeah.
All right. I just want to make sure I didn't. Obviously, I did miss something.
Don't be shy. Kathy, start us off.
I'll only say something if somebody else chimes in as well. Um, I guess I talk so much because this is so important to me as a community member, talking to and speaking to other community members who have gone through the ringer, and I feel validated. And I think what I loved most about this process was all of the rest of you from so many different sectors, and some of y'all's nonprofits that I had heard of, and you know, kind of knew a little bit about what you did, but it felt really validating to feel like we had from these different places we came from a shared vision. So it feels like we're doing something that's very true, and that's really important to me. Not just, you know, what, because I can talk to, you know, maybe reach out to, I don't know, maybe 100 people in the community that I can say that I represent, maybe on a good day. but to know that as, you know, from Netherlands to Sister Carmen to the whole county, that we're seeing and feeling, you know, a lot of the same things. Thank you.
It's definitely made, and Chris and I have talked about it, made us up in Netherlands feel a little less isolated being part of this group. We know it's a different world and we're considered different, but it's been great to talk to people, and I have people ask me about this process when I'm out in public, and it's just nice to be able to bring that to my community. So I appreciate being part of this process.
I think for me, it's been really great to see all of the collaboration across providers and across sectors. And I think it's a great reminder of how much better we are when we're all collaborating and working together and kind of having this shared vision. And so I think I'm walking away with wishing that we did this more in some ways. I know nobody wants more meetings, and especially more Zoom meetings, but I think it's really, it's hopeful, I think, to see all of us come together this way to solve some really big issues in our community, and kind of feel like it's a great model for how we can do more of this together moving forward.
I run a group called Peak to Peak Housing and Human Services Alliance, and we have a monthly meeting. If anyone has any desire to hop in and meet the mountain community, you are more than welcome to.
I love that idea, Katrina. Such a good idea.
I just want to say that I agree with Ellie. You know, I think we should have these kind of meetings more often, you know, representing different organizations, different communities, so we can actually check in how things going and not to wait 3 years or something to happen to try to adjust or make changes to systems. But I think I like, you know, I go with the same feeling that this is great when we come together and start discussing issues important for our communities, and how we can advance, you know, the equity across the county. So thank you for all the efforts, and thank you, Robin, for facilitating this, and Katrina as well.
Thank you. I love hearing this, and it reminds me of the olden days when we used to meet regularly across the nonprofit sectors. And we should bring that back, and, you know, back to Amy's first comment about a public-private partnership that's more transparent, and the access point into the county's work, and making that more evident and transparent. So I'll be calling on you, Jorge. Any other reflections, feedback?
I'm curious to hear if there are any other county staff who want to talk about how this feels like it'll inform the work going forward, and what that collaboration has felt like from your end.
Come on, folks. I've done enough talking, so you guys weigh in.
I can weigh in. I mean, I'm a committee member, but also quasi county person. So same thing with Ellie and Jorge. Hopeful is the word I'm leaving with, and then also hopeful of the future. And I really can't wait to see what comes of the group. And also we should take a lot of pride in being a part of this and what comes in the future.
I'll just say my reflection is that we really do need to have these public-private partnerships because we're all kind of involved in the work, and we have to figure out the best ways for us to support each other and to kind of together build the system over time. And I think the nice thing about what's come out of this process is that these ideas have a lot of overlap in a way to build on each other and really not only address some of the specific issues within each of the focus areas, but really build across a system so that the overall infrastructure and capacity gets built to help address these problems in a more comprehensive way. So it just feels like it was a really thoughtful and consequential process to go through.
I guess I would just say, I think there's a lot of collective wisdom and a lot of care in our community to really serve folks. And so it's great to be hearing about that and just feel like that's, that's a great foundation for a lot more working together. And I'm looking forward to just in my ongoing work, continuing a lot of these conversations with y'all. So beyond ARPA, right? So much more to do too. So
I would agree with that, Marcy, about the collective wisdom. And also I'm struck by how many common themes there were in this conversation to the conversations that we have in our work with young people. And I think that just really speaks to the representation that's here and all the different ideas that are coming out. And I think it's really going to make a big difference in our community. And I'm looking forward to continuing to be a part of it.
I would just add that I hope that as we move forward, looking more in depth at these behavioral health issues in the county, that we can build on what we have here in this group.
I just want to say that I have been involved in the process since the beginning when we did our initial surveys with community participants, and to see it come full range to really being proposals and suggestions now that reflect what the community was requesting has been a wonderful process. And I'm delighted with where we are, and that none of the community's responses were negated. We're all incorporated into our proposals.
Any other comments before we close? Well, I want to really express my appreciation for my co-lead, Katrina. It's been wonderful getting to know you and working with you and hearing your perspective. And, I'll just be honest, Katrina and I were often scratching our heads like, how are we going to do this? And I think we did a lot of problem solving together, which I really appreciated, Katrina. So thank you.
Thanks. And back at you, I felt like I was heard, not by just you, but by this group. So thanks to everybody.
And thank you guys for your outstanding leadership. It's been so great to watch. And we'll see everybody soon.
Yeah, and we'll stay in touch for sure. Thank you.
Thank you too.